Hi, this is Dr. Toby, your host on health and wellness. Don't touch that dial. We have a great show with our own Dr. Clyde Edward Glenn. He's a psychiatrist, he's a pastor, he's a father, he's a husband, and he's a mentor to a new generation. He's also a brother born to a family of 11 children. I mean, 21st century, that was considered female having 11 children. That was amazing. In the Delta, in those days, he was brought up in the Delta, took his education all the way from Cleveland High School to um, down to Alcorn University. From Alcorn, went to Iowa, University of Iowa. Then from University of Iowa, he went to Ohio State for his residency in psychiatry. He's also pastored for years. He pastors at the Chapel Hill Missionary Baptist Church in Clarksdale, where he's been for 25 years, and he's been married for the last 35 years to his lovely wife, who's a pathologist. They have four lovely kids, two of whom I've been privileged to train in the University of Mississippi, and I'm just honored, delighted to have Dr. Clyde Edward. I know I keep butchering it on the show. Thank you so much, sir.
Good
What
to
an
be here.
honor and
Thank
what
you
a
for having me.
privilege. Thank you
Yes,
so much.
yes.
So we were talking before we got caught up last time about psychiatry, and you are, I see you're a lover of the history
Hmm.
of psychiatry,
Yeah,
because a lot of us don't even know the history.
right. Yeah,
There's a history behind the whole philosophy of psychiatry. A lot of people know about the Chung, the psychological background, the different schools of thought,
hmm,
Sigmund Freud, and
right.
I think it's Chung or one of those things. But nobody ever really talks about the history of the medical science
Hmm,
of psychiatry. So, where we stopped last time was your journey at Iowa. You got
Yes.
to Iowa, fell in love in your first year. Now, weren't you worried you were leaving home so far away? Weren't you concerned?
That didn't bother me or
Clarksdale
concern me.
to Cleveland to Iowa.
It didn't concern me at all. Um, that's where I needed to be to do what I needed to do.
Your
My,
parents weren't worried you were
no,
going so
no,
far?
no.
Wow.
In fact, it's interesting you bring that up. It brings to remembrance a experience that I had because I was in the band at Alcorn, and that band scholarship was paying my way through school. Mr. Samuel Griffin, who gave me that scholarship, the band director, made sure that I was in every band they had, whether it was the marching band, the jazz band, the concert band, whatever I had to pay
Mm,
with my services and
to
my
be there.
talents
Wow.
to basically go to school free. Well, that often meant that I had to come a week or so early for band camp before school started
Oh,
every fall.
wow. Mm,
And I was attending these summer health science programs, and they would run right up to the point of
wow.
me having to be at band camp. In fact, the Harvard program actually went past it a bit. So when I got home, I didn't have the opportunity to spend time at home. We
Wow.
love being around one another. Okay,
Right.
one of my nephews says, "Man, somebody goes off to college, everybody starts crying and hugging." And he said, "I was afraid to go to college. I thought it was a bad thing because everybody was crying." I didn't have opportunity to just spend time at home with everyone,
Hmm.
and I was very tearful. Going back to school because I had only been there for a day before having to go to Alcorn, and I knew because I was in the band I wouldn't really see anyone until the first major holiday, which would be Thanksgiving. So my father came to me and he said, "You need to stop crying, dry yourself up," as he would put it, and go ahead and do what you need to do because what you want, we can't give it to you here.
Oh, wow.
So you got to go to school. Now, this
Wow.
is from a man who, at best, had a third grade education, and that's in the church, kind of everybody in the
Right.
same building, basically, maybe a month or so of school every year, and then you're in the fields. But he understood the value
The
of
value.
education by
Wow.
that point, because others older than me had,
Hmm.
gone to college and gotten degrees and things of that sort. So it wasn't an issue. That settled it that day
Oh
for me.
wow.
So when I went to Iowa, it was just a thing that had to be
Get
done.
it
Now,
done.
yeah, we once I was accepted, my brother Howard, the same brother that I keep
Hmm.
mentioning, he planned a trip for mom and dad, myself. We drove up to Iowa. My mother and father got to meet the people in the admissions office and
Oh
those
wow.
administrators in the medical school. And my folks were just country old people, right? So they would send me back when I would go come home from breaks with bags of peas and greens, and because they had these huge gardens, right? And I would take those to administer. I don't know what they did with that stuff, but it's
Oh
like mom and
really?
dad has sent this to you guys. but
Oh
um,
wow. That's
but yeah, so
thoughtful though. Yeah.
it wasn't a concern at all. I was simply
Wow.
doing what I needed to
Hmm.
do. Sort of had a sense that there was a higher call on my life, and once I decided on psychiatry, started to read a little bit more just about the history of psychiatry, but also the African American
In
experience
psychiatry.
with psychiatry, and unfortunately. Uh, in many cases, because psychiatry had its experimental beginnings just like all of the other areas, and the slave trade.
Hmm.
Slaves were utilized for experimentation, basically.
Hmm.
Not to mention, even after slavery, uh, the quality of care for African Americans was fairly substandard. Often, cultural issues would enter into play. And that's a real issue
It
even
is.
now, to the
Right.
point that many medical environments will have cultural sensitivity training
Training. Hmm.
to try and assist individuals in just being a bit more human
Hmm.
in
They
dealing
call
with
it
others.
cultural competence. Yeah.
Yes, yeah,
Hmm.
which is not something you can train, right? That's a
Right.
heart
It's
matter.
a
That's really not a head matter. That's a heart matter. But anyway, I made some decisions at that point that not many African American psychiatrists. So I know I'm doing something that's going to be, you know,
Mhm,
not common.
mhm.
Um, but we have an experience, and I want to do my part to bring quality psychiatric care
To
to
that
people who look
population.
like me.
Right.
Now, not all of my patients look like
Of
me,
course.
but that was sort of the
Sort of the.
impetus at that
Mhm.
at that particular time.
Wow.
But God is blessed. I have a wide array ethnically of patients, and I would dare say that some of them, you know, don't want me to go anywhere or retire
But
or
you moved
take
from.
off
You
or
took off
anything.
from Clarksdale to Richland. Did they all follow you?
I had many patients that actually did. I
Oh
had patients
wow.
that would travel
To see you.
to yes.
Wow. Wow.
But a number of them were. By the time we moved. I had sort of morphed my practice into a contractual based practice. So I would just go to where the services were needed.
Okay. Okay.
And so the
Provide
patients were
service.
were
Right. Right.
stationary.
Right.
Now, uh, one of the community mental health centers that I worked with, um, uh, Region 6, which is called Life Help, covers a large number of counties in the Mississippi Delta. There were some patients who followed me
Mm.
from there. Uh, I have since, for about 10 years now, uh, been doing telemedicine with
Oh
that.
wow.
I got special permission from the Mississippi Board of Licensure to provide services in a low service area. So
Before the
long before
before the
COVID, yeah,
world started doing
yes,
telemedicine.
yes, long before
Wow.
COVID, I was doing telemedicine already, and a lot of
Wow.
doctors certainly
Just
did
started
that
cutting.
during COVID. But we had already sort of mastered that approach and was
Wow.
providing those kind of services and have been doing it for 10 years or so.
Okay.
But we moved to the Madison area again for educational
Mhm.
reasons, and it just turned out to be the move to make. I did offer uh, Chapel Hill the option of, hey guys, I'm leaving town. I, you know, you may want to get a different pastor.
Mm-hmm.
And basically, they said to me, if you are okay with driving up here, we're
We're
okay
okay.
with you living in another city. And I think to some degree, and I say this humbly, they just knew me. They
Right.
knew they weren't going to really be suffering too much.
Mm-hmm.
I was,
Did you sell your property? Your wife had to get another job in the Jackson area, so
yes,
there was some transition.
yes, yes. She, for about a year, well, she did some locum tenens work,
Mm-hmm.
and then she got the job at the VA there
Right.
in Jackson, and now she is actually the chief of pathology
Oh,
of
okay.
that department. She
Oh,
runs that
department.
pathology
Oh, wow.
department now.
Awesome.
Yeah,
Yeah.
yeah. So, but I mean, there are always sort of transition
Mm,
issues to deal with, but we made it through that
that's
just fine,
superb.
and
Yeah.
we're where we are now.
So why Ohio State? You were going to tell me your wife's side of the story.
Oh yeah,
Okay.
in medical school. So
Right.
Celeste is the only medical student any of us knew who stayed with the very same idea of a profession from the day she walked in to the day we
Really?
graduated. Everybody was changing their mind.
Right.
One minute it's psychiatry, one minute it's internal medicine, another minute it's dermatology, another minute it's surgery.
Yeah.
Everybody's just kind of all over the place. Celeste walked in that first day, I'm going to be a pathologist, and never changed her mind.
Wow.
Never changed her mind. Okay.
Pretty
And
impressive.
she said that she had been in nursing for a little while prior to,
Oh.
and she knew that direct patient care was just not for her.
Wow.
It was a little more challenging emotionally, because people pass on and things of that sort, and you got to be able to handle that.
You gotta be strong.
Yeah.
Yeah.
So she, so she said, no, I can't do that. So she walked in the door with pathology in mind, and she walked out the door a pathologist. Okay.
So you chose Ohio State because it was a couples match?
Yes.
Oh,
Yes.
okay.
Yes. It was one of our. I think it actually was our number one choice, and we got our number one choice. We interviewed at several places,
Wow.
obviously, but that was our number one choice, and we were very excited, very happy.
You didn't
on
mind the
match day.
weather, the cold weather, the
We
snow?
had been in Iowa, man.
Okay.
I mean, it didn't matter anymore. In fact, the weather in Ohio, certainly in Columbus, much milder
Oh,
than
really?
Iowa City, Iowa winters.
Wow.
Those were real winters.
Those are real winters.
Yeah, yeah. None of my clothing worked coming from Mississippi. I had to do a whole new wardrobe. My boots, I threw those away. My coat, this doesn't work up here. So,
So I know Ohio State is a big football town. I think they call them the Hawk.
well, Iowa's the Hawkeyes, big football team
Yeah.
as well, but Ohio State,
Ohio
the
State.
Buckeyes.
The Buckeyes, right.
Yeah.
So you were in Columbus, and what was your experience like in the city and the people and the environment? You were still far from your mom and dad.
Yes.
Were they still alive at that time?
Yes. Yes.
Okay.
And a few times they came, spend a week or two or
Okay.
whatever with us while we were there in Ohio. We got married in Iowa.
Okay.
We were in our fourth year of
Medical school.
medical
right.
school, and all of my folks came. My wife's folks came, and we had gotten into fishing,
Huh.
and so my wife and I caught just a huge number of striped bass, and for our wedding party,
In Iowa.
in Iowa. Right
Wow.
there in town at what we call the Dubuque Street Bridge. There was a little and we caught all the fish for our wedding
Wedding.
party fish fry that night before our wedding.
My
Anyway, my
goodness.
folks loved it. Her folks loved it. Everybody got along well. We had a great time. And
You told me 4 of your siblings went to college or so. So give me a little background. I know Howard became a dentist. Hannah, is that her name?
Helen.
Helen became
Yeah,
a
she's a psychologist. Yeah. So, and we're the only, and my youngest sister, Doris, we call her Dot. She's an environmental specialist, but she
Uh,
doesn't work in that area. But she too
so those are the
completed.
four.
Yeah,
Wow,
yeah,
that's amazing
yeah.
privilege.
Now others certainly
Pursued.
attended,
Yeah.
college, but did not complete it
Wow,
for
wow.
various reasons.
So,
Yeah.
any regrets so far in the in the psychiatry field? Any regrets looking back? Any
No, I did what I think I ultimately was called to
what's
do.
called to
Yeah,
do? Okay.
yeah,
So, in the last 10 years, a lot of people have started talking about marijuana in the field of psychiatry, and I just felt we're talking about Mental Health Awareness Month. They've legalized it medically in Mississippi, in Louisiana. It's also medically marijuana is available. So a lot of my viewers are, they don't know what the medical philosophy about marijuana is. Let me use the word medical policy because you hear more from the politicians than you hear from the physicians. So I just wanted to get your thoughts so my viewers can at least know what to take home in terms of is marijuana useful in the world of psychiatry? Are we doing harm or are we doing good when we
yeah.
prescribe medical marijuana? And obviously, your thoughts are your thoughts so that we don't amplify them and put them on somebody else's. But, you can just tell us your thoughts on that score. Because I think a lot of viewers are concerned. They don't know the truth. They hear so many parts of the truth.
Sure. Yeah.
Hmm.
Well, I let me first just say that marijuana has been around for a very long time.
Hmm.
People have used it for various reasons in various settings, and I think the fact that so many states in the United States now
Hmm.
have made it legal for both, casual, leisure use, as well as some states more restrictive with medical use, is really just sort of a reflection of the times. Uh, um, uh, with it being the type of drug or natural substance, if you will, that it is. But as a psychiatrist, I have seen sort of both sides of this equation, um, and I look at vulnerabilities, and I think while it may be legal in some states to just casually use it, restricted in others, there are probably small percentages of individuals that derive benefit from it. Um, and it may not be so much that you're deriving benefit from marijuana as opposed to cannabis, the sort of the
TH.
non-THC, the non-get high part of getting high part of the plant. So some of the cannabinoids have been shown to reduce levels of anxiety in some patients, have been shown to maybe improve depressive symptoms in some individuals. And then, of course, there are the question of the pain management uses of it as well. But, you know, I didn't grow up with a silver spoon in my mouth, so, I'm from the hood too, right? So, we know that a lot of folks who are just in Mississippi anyway, who are trying to get their hands on marijuana. They've been smoking weed all the time. It's just that now it's legal, so I want a diagnosis attached to it. So if I get stopped with it, I'm okay, right? I mean, let's just be real about this thing. But I have seen individuals, and some of you may remember sort of the spice craze that came about 5, 6, 7 years ago, and basically what it is you have a chemical that's sprayed on marijuana or any green substance, oregano, whatever, because some people don't know what they're buying on the streets. And I've saw a lot of kids who were first-time marijuana users. In some cases, it was proven that this marijuana had been laced with other things, who became psychotic. And the problem with psychoses from marijuana and other drugs, substances of abuse, is that you don't know if it's going to go away.
Mm.
It may be something you have to deal with for the rest of your
Rest of
life.
your life, right?
The other thing is that while we have medications to treat psychotic symptoms, hearing things, seeing things, feeling things that are really not there, drug induced
Mm.
psychoses is different from a
Oh,
physiologic sort of evolving of psychoses due to some brain related changes that the individual may go through.
mm.
You're killing something with the
Wow.
drug,
Wow.
whereas it may simply be a gene
Mm.
not being expressed,
Mm.
in someone who has a true schizophrenia or psychosis.
Right.
So the medications don't always work
Right. Right.
like one would want
Hmm.
them to.
So there's some harm being
Yeah,
done.
yeah, and so for me, kind of the jury's out on that. I know that people use it, so I don't, you know, knock it. But on the other hand, I specifically chose not to go for the certification
Mm.
because I think that some individuals may be vulnerable, and we don't have a way of knowing who is and
Who
who
is
aren't.
vulnerable,
Yeah.
right? Because what they taught us in residency was it could be a gateway drug
Yes.
to other drugs, like you said, the spice craze, and so you think you're getting is it candy balls or
Yeah. Yeah.
marijuana? I don't know if it's toffees or biscuits or
Right.
candies,
Right. Right.
and then you
Rice
get
cakes and all kinds of
and
things.
then they mix it with cocaine or
Yes.
something more,
Right.
addictive
Right.
to make you return.
Turn.
Which
Absolutely.
I hear there's a part of the brain that is stirred up. Am I right when these drugs are introduced?
Absolutely. Yeah.
And you keep wanting more of it.
Absolutely.
You know.
Well, one is just the reward center
Okay.
of the brain. Um, uh, Anything that we do to our bodies that makes us feel good,
Mhm.
have a sense of satiety, if you will. We feel fulfilled in some way, at ease or relaxed more than we ever have been before.
Mhm.
That's addicting,
Mm.
and we want to re-experience
We're
that
experiencing
over and over and over again. And the brain rewards you for, and when the brain does not have it, it desires it, it craves it. So, you can set in motion these processes that could lead to addiction, and individuals tend to utilize a variety of substances
Mm.
in order to try and repeat
Right.
that same feeling, and so that's why I think we see such widespread and a wide range of things being used
Mm.
to get high or to
So
sort of
gambling
experience
can
it.
be addictive.
Yes.
Betting can be addictive. Alcohol can be addictive.
Yes,
Drugs can be addictive. Nicotine can be anything that gives you that sense of reward or pleasure
absolutely,
can become.
absolutely, and that's a brain phenomena. Your brain is designed, if you will,
Mm.
to respond to pleasure and reward. Okay, and the problem is that individuals can get into these patterns where they're
Mhm.
unable to really, you know, exercise any restraint.
Restraint. Okay.
Yeah,
And they come to see you, and you have to do some behavioral modifications,
yeah,
help them with changing their perspective, maybe.
yes, yeah,
Okay.
and ultimately that is something that comes from within.
Mm.
You have to really want to change.
Okay.
The joke is, people say, how many psychiatrists does it take to change a light bulb? Only one, but the light bulb has to really want to change, right? That's sort of the joke. But there's truth to the reality of change has to be something that is an outgrowth of the individual. So if an individual comes to you and they have diabetes and you tell them that, you know what, you can get off insulin. All you got to do is exercise and eat properly. Now, who has to do that? You can give them a dietary list of the best foods to eat. You can give them the name of every exercise center in town. But who
They
has to
have to.
go?
They have to.
The individual has to
Hmm.
do it.
They have to.
It's no different
Yeah.
with addictive disorders as well.
Yeah, there's a famous soccer player in England, and he's one of the top soccer players in England, but he's just been suspended for 18 months from his career because he has a gambling addiction. So he's betting on the games he's playing,
Right.
and now his career is up. He's lost his career,
Yeah.
and you'll be like, "What was he thinking?" But like you said, it's a brain thing.
Yeah.
Because he's earning enough money from his soccer.
Right.
He doesn't need to bet to make any more money.
Right.
But he was just caught up, you know.
Yeah. Yeah.
So the question now in England is, should they penalize him? He has an addiction. It's a weakness, it's an illness. Why are you punishing him for something that is considered an illness instead of giving him a therapy? You know, so there's two sides of the story.
Yeah.
And people are, concerned about him. So I
Yeah.
see your point with you. But last but not the least, right now marijuana is still a Schedule 1 drug. So I just want to let the people know that nationally the FDA or the DEA still considers it a Schedule 1 drug. But when you use it medically, it's used within the local confines. But there's still the DEA rules on the
Absolutely.
marijuana.
Yeah.
So people should be careful because if the DEA catches you,
Yeah.
or the feds, you can still be persecuted,
Absolutely. Yeah.
you know.
Yeah.
So we're going to come back on the last show. We're going to talk about family. Married for 25 years, 4 lovely kids, one daughter-in-law, another daughter-in-law on the way. How has he been able to maintain family, medicine, ministry in one boat? That he's going to tell you in the next show. God bless you. Jesus is Lord. Amen.